So let's look at the next type of hematuria, which is basically what? The asymptomatic hematuria. Looking at this word critically, you see that what? You can see symptom inside, but you can see A. So anytime they add A to something, that means the thing is not there. Okay? And what is hematuria? That's passing of what? Blood in urine. So asymptomatic hematuria, that means what? Yes, you are passing out blood in urine. That's alright. There are no associated symptoms. Alright? So it's difficult to actually dictate what is actually causing it. Right? So we'll be going from the definition, we'll go to the possible causes, we'll look at the evaluation, look at the management of this disease condition. So for the causes, definition. We say that asymptomatic hematuria refers to what? The presence of blood in urine without any noticeable what? Symptom or sign. Okay? So there are no other signs or associated. Do you understand? So that means there is blood in urine. Okay? But unlike the normal type of hematuria that we know, in this one, there is no painful urination, also known as dysuria. There is no frequent urination, also known as what? Frequency. There's no urgent need to urinate, also known as what? Urgency. Okay? There's no abdominal pain or discomfort. There's no fever. There's no chills. There are no other symptoms. So how can you be able to dictate what is causing this? Right? So you might want to do some intense what? Evaluations. So let's talk about the possible causes. It could be that there is a disease condition, but probably this disease condition is just starting, just still mild. Okay? And this disease condition can include disease of the kidneys, like glomerulonephritis, interstitial nephritis. It could be that there was kidney stones or gravel. It could be that there was benign prostatic hyperplasia. It could be that there's urinary tract infections. It could be that there's kidney damage or scarring. It could be that there's inflammation of blood vessels, that's vasculitis. It could be that there is actually a genetic disorder like Alport syndrome. Right? It could be that the person is currently taking some medication, so you have like the side effect of it. Medications like anticoagulants, aspirin. Okay? Then for you to actually dictate this medical condition or to be able to manage it, you might want to actually what? Evaluate it. Okay? So the possible evaluations, you might want to do urinalysis just to confirm hematuria. You might want to do a urine culture test just to rule out other infections. Okay? Then you might want to do imaging studies like ultrasound, CT scan, just to visualize the urinary tract. Okay? Then you might want to do cytoscopy to examine the bladder and urethra. Okay? Then also you might want to still do some blood tests just to assess kidney function and rule out other possible causes. Right? What's the possible management of this strange type of hematuria, which is just presenting as blood in urine? There are no associated symptoms and all the stuff. Okay? You might want to monitor the kidney function and urine output. You put an eye on it so that what you don't have it or progressing into another problem, right? You might want to address the underlying causes like kidney disease or benign prostatic hyperplasia. Then, if it is looking too cryptic, you just refer the person to a nephrologist or urologist. Those ones, they are specialized for kidneys, so they can actually give the patient some specialized care. Then regularly you follow up the patient just to assess disease progression and adjust treatment, because the disease will not remain asymptomatic forever. So you might want to actually what? Prevent it from going into the symptomatic one. All right. Then you should consider further testing, like can do some kidney biopsy if hematuria actually what? Persists. All right. So that's it for the asymptomatic hematuria. We'll be going into the next type of hematuria. See you guys.